There's this medical event that's surprisingly common. It affects up to 20% of people in developed countries, but it usually starts completely silently without any warning at all. So today, we're going to follow the patient's journey through what's known as a gallstone attack.
Okay, picture this. You get this sudden, really intense pain in your upper belly. It just keeps getting worse. It's the kind of thing that makes you think, I need to get to the ER right now. And you're left wondering, what in the world is happening? Well, a lot of the time, the culprit is this tiny little organ you probably never think about, your gallbladder.
So what's actually causing all this trouble? Gallstones. The best way to think about them is like hard little pebbles. See, if your liver pushes out too much cholesterol, the bile inside your gallbladder can get all saturated. That extra cholesterol starts forming solid little particles. And these tiny crystals, they start clumping together, growing into what we call gallstones.
Now, here's the thing that's going to blow your mind. A whopping 80%, 80% of people who have gallstones don't feel a thing, no symptoms at all. They're called silent stones, and they can just hang out for years, maybe even your whole life, without causing any problems. And that's exactly why an attack can feel like it came out of nowhere. The problem was hiding there the whole time. So while pretty much anyone can get them, some things definitely up your chances. According to the MSD manual, they're more common in women. Your risk also goes up as you get older. And things like obesity, losing a lot of weight really fast, and even just your family history, they all play a pretty big role. Okay, so what happens when these silent stones finally decide to stop being so silent? Well, this is where things get serious. It's the moment a quiet, hidden problem suddenly turns into a full-blown, painful attack. Think of an attack as a chain reaction, right? First, one of those little stones gets lodged and blocks a duct. So now the bile has nowhere to go. It gets trapped, and the gallbladder starts to swell up. That's when you feel that intense pain. It's called biliary colic. And if that stone stays stuck, the gallbladder gets inflamed, and you've got a much more serious situation called acute cholecystitis. And I really want to be clear here. We're not talking about a little stomachache. This pain is so intense, it's what drives people to the emergency room just looking for relief. It can build up for an hour and then just stay at that peak level for hours more. It's absolutely brutal. So what can actually trigger this whole painful mess? You might be surprised. A lot of the time, it's just a heavy meal. See, when you eat, your gallbladder naturally squeezes to release bile to help with digestion. But if a gallstone is in just the wrong spot, that squeeze can force it into the duct, blocking everything up. And boom, that's the start of an attack. All right, so once a patient gets to the emergency room, the doctor's first job is to figure out what's going on. They need to be sure it's the gallbladder causing all this trouble and not something else. So how do they start connecting the dots?
To really nail down a diagnosis of acute cholecystitis, doctors have a sort of checklist. They follow these specific criteria, known as the Tokyo guidelines. Basically, they're on the lookout for a very specific combination of signs.
The very first clue is all about location. The doctor will do a physical exam, and they're focusing right on that upper right part of your belly, exactly where your gallbladder lives. Any pain, tenderness, or if they can actually feel a lump there, that is a huge red flag. Clue number 2 comes from your body's system-wide reaction. See, acute cholecystitis is all about inflammation, and that inflammation leaves clues in your blood work. So doctors are going to look for things like a fever or a high white blood cell count, the very cells that fight off infection. And the last and maybe most important piece of the puzzle is actually seeing what's going on. To be absolutely sure, doctors need to get a picture of the gallbladder. So imaging tests are absolutely crucial here. And the go-to test for this, it's an abdominal ultrasound. It's the first thing they'll do because it's super fast, it's safe, no radiation, and it's incredibly accurate, about 95% accurate for finding gallstones. Now, sometimes they might use an MRI or a CT scan for more complicated cases, maybe to get a better look at the bile ducts, but the ultrasound is almost always where they start. Okay, so once the diagnosis is confirmed, the conversation shifts pretty quickly to treatment. And for acute cholecystitis, there is a very clear, definitive solution, what's known as the gold standard of care. Doctors use this whole coding system to classify different diseases. You can see an example right here. The specific code for acute cholecystitis is K81. It's just one of several gallbladder conditions that basically signal, hey, it's time to intervene. And that intervention, it's surgery.
And that surgical treatment is called a cholecystectomy.
It sounds complicated, but it just means the surgical removal of the gallbladder. And this doesn't just fix the immediate problem, it gets rid of the source of the gallstones for good.
So how do they actually do this surgery? Well, today, something like 90% of these procedures are done laparoscopically. This is a minimally invasive approach where they use just a few small cuts and a tiny camera. I mean, it has totally revolutionized the procedure compared to the old-school open surgery method. And why is this laparoscopic way so much better? The benefits for the patient are just huge. We're talking less pain after the surgery, a way shorter hospital stay, usually just a day or two, you recover faster, and the scarring is minimal. It's a win-win-win. Really, the medical community is unanimous on this. It's just clear and simple. The laparoscopic method is the best option out there. It's become the standard because it works incredibly well with way less impact on the patient. So after the surgery is done, the last part of this whole journey starts recovery. And, adjusting to life without a gallbladder. This is where people usually have the most questions, right? So what is life like once your gallbladder is gone? The biggest change is that bile doesn't get stored anymore. It just flows straight from your liver into your small intestine. But here's the amazing part, what doesn't change. For most people, digestion just keeps on ticking like normal. You don't even need a special long-term diet. Your body just adapts. It's pretty brilliant. And all of this really brings us to the single most important takeaway. If you ever feel that kind of intense belly pain, getting it checked out early is so important. An early diagnosis means the surgery is simpler and your risk of complications goes way down. It's pretty incredible when you think about it. This tiny little organ, shaped like a pear, can cause so much trouble, just enormous pain. But modern medicine has figured out how to fix the problem completely. With a surgery that's so refined, people are often back to their normal lives in just a matter of days. It really makes you appreciate how far medical science has come, doesn't it?